well-known Silverton teacher is taken into custody accused of raping a boy for years.
So fortunate to be back to work.
Could the economy be turning around for the better? What local company is bringing their employees back to work?
Live at 11, this is K2 News on your side.
Good evening and welcome to K2 News at 11. You are looking live at a panel of K2 viewers who watch the ABC special Questions for the President, Prescription for America, right here in our studios. And in just a moment, we'll get their feedback on some of the health issues discussed in the past 60 minutes. But first, during tonight's discussion, everybody in the White House audience seemed to agree the health care in America needs to change. But the question is, how? President Obama talked about how the current system is bankrupting families, business, and the government.
If we are smart, we should be able to design a system in which people still have choices of doctors and choices of plans that make sure that the necessary treatment is provided, but we don't have a huge amount of waste in the system, that we are providing adequate coverage for all people, and that we are driving down costs over the long term. If we don't drive down costs, then we're not going to be able to achieve all those other things.
And good evening. Thank you very much for being with us, everybody. That was the president just a short time ago. We have assembled an esteemed panel from all walks of life here. They've been watching the president for the last hour. We appreciate you guys coming here tonight. Show of hands if I can see how many folks actually took something away that they liked tonight from the president's discussion. Show of hands on that. So how many did not? Let's start with you then, if we can. Rachel Borkelin over here. We always start with a pregnant woman, they told me. 6 months pregnant, 32 years old. You got a couple of kids, one on the way. What did you not like, what you heard tonight?
His focus is on empowering government, and I want the choice for myself to be able to pay my provider directly. I don't want the insurance company paying for me or the government paying for me, because then they're making the decisions. And my first birth was in a hospital. They charged $13,000, and my second birth, I just went ahead and hired a midwife directly. It was $3,600. And it was much less expensive because she was working for me. There were no bureaucrats in the middle. At the hospital, the bureaucrats were telling me, you know, what they wanted and try to push things on me that I didn't want and I didn't need. And he wants to cut costs. Well, then you should empower the patients, not empower the bureaucrats to decide, well, you need this care, but you don't need that care.
I want to jump into the front row if we can. Tom Cox ran for governor, Libertarian ticket. You also protested outside K2 a couple of days ago. Glad you didn't bring the picket sign tonight. And so nice to have you here. But what did you see tonight that you liked or didn't like?
Well, I like the fact that everyone in the room agreed that we need change, because every so often you'll hear someone, well, people who don't want any change. And I'm like, well, who is that? I can't find anybody who wants no change. And so, yeah, we need to have change that empowers patients. We need to have change that doesn't depend on a new government bureaucracy to deliver savings and reduce paperwork. I mean, if he's got an example of that ever happening, I'd love to know it. I mean, why didn't he trot that out for the porculus stimulus plan or the bailouts or one of those? I mean, it's pie in the sky. And he said that he's going to not drive the private insurers out, but when Medicare came in, it drove out every single insurer of the elderly. So the idea that this public plan is not going to lead to single payer is absurd. The guy who proposed it, Dr. Jacob Hacker, said he proposed it because it was going to lead to single payer.
I want to jump back in the back again. Susana Serna Lopez, a nurse practitioner for a long time, owned your own clinic as well. We talk about the change. Do we need change? Because you don't even take insurance, do you?
No, I don't take any insurance. I charge a flat fee for the office visit and physical exam. I try and prescribe from the lists from Target and Walmart, wherever possible. And one of the reasons I started my clinic was because, well, for several reasons. One is because I didn't feel like I could offer good care when I was being told by the bureaucrats in a clinic that I had to see a minimum of 24 patients in an 8-hour day, plus all of the rest of the stuff that had to go with it. That's too many patients, and I knew I would miss something. I didn't feel that patients were being given the care that they needed, and because I didn't want somebody in an insurance company telling me whether or not I could prescribe whatever that I knew a patient absolutely needed. And when I would find out that the person telling me I couldn't prescribe it was fresh out of high school, It was very frustrating.
Susanna, pass that microphone if you would, right next door to Lynn Medor if you can. Math teacher, Clark College. You work 2 part-time jobs to pay for health care.
I do.
What did you think when you saw it tonight from the president?
Well, I think that's my concern. Will I be able to, with this new policy that we're looking at, will I be able to afford the monthly premiums? Right now I pay $469 a month for myself. And will I get good coverage for this new package that he's deciding to put forth? So my concern is, will I have to work forever to pay for those premiums?
Guy Mickelson, grab the microphone from her if you would. You're HIV positive?
Yes.
Watching the president tonight, did you see anything you liked?
Well, he made one thing that I sort of had to agree. You know, you got to have essential, like is explained to me. You have a general practitioner. He's sort of your brain, and he sends you out to everybody else, like with the Mayo Clinic. You have one doctor, and the other doctors are going from his notes, not sending you to this doctor and this having repeat tests and this test repeated. So it does cut down on costs.
Leanne Church, you deal with the patients and insurance all the time. Mount Hood Hospice, what'd you see?
I heard ideas, but no bones to support them. I'm concerned that he talks about good quality care for everyone, but that's not defined. What is that? He also talks about cutting waste. Hospice care, there's a proposal now that this next year, on average, it's going to be cut 3%, a little over 3%. Most hospices operate on a margin of about 3%. So he's talking about cuts to fund this, and he talks about elderly being at part of it because they're not being taken care of and end-of-life decisions, but he's cutting right in the heart of one of the most successful programs the government has.
I want to get back down here in front if we can, because I saw you shaking your head quite a bit through the program, Frank Wilson, retired Marine and Army Sergeant as well. What were you shaking about?
I got left with a lot of confusion over what he was saying. Part of that was during when he was talking about the insurance companies, and we have our choice for the policy. If we're happy with our policy and our caregiver or our providers, then we can keep that. If not, then we have the choice to change. I didn't get the part where if we make that change or we keep happy with our policy during this reform, are the insurance companies going to then at that point change our policy providings of the certain items that we get through the policy if we're happy with, and if we decide to change that policy, are we going to be cut some of the services? Are we going to be added to on a service? Or are there certain services that we're not going to receive? So I was very confused with that.
We're running out of time, unfortunately. We have some other news to get to. I appreciate all you guys coming here. I apologize the ones that I could not get to, but thanks for coming in tonight. Honestly, we know something has to change, and you guys seem to all agree about that, so thank you very much. Deborah, back to you.
Thank you, Steve. And the conversation with President Obama continues on a special edition of ABC's Nightline. It's at 11:35, right after this newscast. The president answers more questions from the guests gathered in the White House, and Charles Gibson addresses the things not covered during the primetime special.